In today's video, we will be discussing the key differences between cardioversion and defibrillation. Cardioversion is a procedure commonly used to restore a normal heart rhythm in patients with certain types of irregular heartbeats, also known as arrhythmias. Defibrillation, on the other hand, is an emergency procedure performed to restore a normal heart rhythm in patients experiencing life-threatening arrhythmias, specifically ventricular fibrillation and pulseless ventricular tachycardia. One major difference between the two is the timing of the shocks delivered during the procedure. In cardioversion, the shocks are carefully synchronized with the patient's EKG, or electrocardiogram, to occur during a specific phase of the heart's electrical cycle. In contrast, defibrillation delivers quick and unsynchronized high-energy shocks to the heart, without being concerned about the timing with the cardiac cycle. Another key distinction is the level of sedation required for each procedure. Cardioversion is usually performed under conscious or light sedation, whereas defibrillation often requires deep sedation or general anesthesia. In terms of patient preparation, cardioversion typically involves a thorough evaluation of the patient's medical history and current medications to ensure safety and optimal outcomes. Defibrillation, being an emergency procedure, may not require the same level of pre-procedure evaluation, as time is critical in these situations. The energy levels used in cardioversion and defibrillation also differ significantly. Cardioversion usually employs lower energy levels to safely convert the heart rhythm, while defibrillation requires higher energy levels to successfully restore a normal rhythm in life-threatening arrhythmias. Furthermore, the paddles or electrode placement for each procedure vary. In cardioversion, the paddles or electrodes are placed in specific positions on the chest and back to deliver the synchronized shocks. In defibrillation, the pads or paddles are placed on the chest in different positions to bypass any potential interference caused by the heart's electrical activity. It's important to note that cardioversion can be a planned procedure, performed in a controlled environment, whereas defibrillation is typically performed in urgent or emergency situations when immediate intervention is necessary. Lastly, the success rates for cardioversion and defibrillation differ based on the arrhythmia being treated and the underlying factors contributing to the abnormal heart rhythm. Overall, while cardioversion and defibrillation are both effective in restoring a normal heart rhythm, their differences lie in their purpose, technique, timing, sedation level, energy levels, and paddles or electrode placement.